Kia ora and good afternoon, and welcome to the slightly soggy day here in Auckland, and for joining us today on this talk with Mental Health Foundation. My name's Steve Hayes. I'm a partner here at RSM New Zealand, and I'll be your mini host for today. And just a bit of housekeeping. We'll get through the webinar today with Shaun Robinson, who's going to talk to us today about mental health. And through the course of the webinar, you will have the opportunity, should you wish, to participate by raising a question on the Q&A, which is on the panel below you. Hopefully you can see the little Q&A marker. If you click on that and put a little question in there, it'll be collated, and then we can ask those questions towards the end of today's webinar. Obviously, if you're sitting at home, you'll know where the bathrooms are and where the emergency exits are. And hopefully you can remember where those are for the next half hour, should an emergency arise. Should one arise here, unfortunately, you're going to go to blank screen and I'm going to be running for the door, but hopefully all will be well, even if it is tempestuous and it looks slightly cyclone prone outside right now. Today's topic is actually very important, and I think it's very timely. It's a discussion that's been brought to the fore probably by that dreaded word COVID and the impact it's having on individuals within the workplace and also in the wider community as well. So today, Shaun Robinson from the Mental Health Foundation is going to talk to us about the challenging times that we currently have and how we can possibly best demonstrate some resilience to some things that are going on, and also about the impact upon those around us, our colleagues, our staff, and our wider whānau. Before I hand over, I'd like to take this opportunity to thank you all once again for making this presentation today and for attending. And here we go, across to you now, Shaun.
Kia ora, everybody. It's great to be here back at RSM. I think I presented in a seminar rather than a webinar a couple of years ago. And yeah, really appreciate it. I've known Steve for a long time, you know, and a number of you I'm sure I met in that previous time. I'm just going to share some slides that I'll speak to. So, you know, when we're considering any of these topics around mental health, wellbeing and resiliency, you know, I often like to start with that fundamental question: what is mental health? And it's interesting because while it's health that we're talking about, invariably many people think of mental health automatically as a negative. They think of mental health as being synonymous with mental illness or mental distress. And, you know, we often have even people that are, you know, closely involved with the Mental Health Foundation saying things like, I had mental health last year, meaning I was going through a tough time with my mental health. We wouldn't say that about our physical health. We wouldn't say, I had physical health last month, meaning I was unwell. And, you know, I think that's an interesting sort of insight, because I think it speaks to the kind of scariness, the stigma, and the general kind of negative aura around the notion of mental health. It's kind of relates to, I think, our traditional views of what mental health is. So if you look at this diagram here, you know, traditionally on the horizontal axis, we've tended to think of mental health as mental illness down one end, and then the lack of mental illness as the other end, and you know, just a very simplistic view like that. And in fact, our objectives have been, if we see mental health, then we just try to move people to see mental illness. We just try to move people to the lack of mental illness. And you know, much of our sort of clinical approach has really been around that over many decades. But in fact, that's, you know, it's not a particularly useful framework for understanding our lives. And so we've been very influenced by the work of a number of academics and thinkers and leaders in the field over a couple of decades now. And Dr. Corey Keyes was one of the first. And it's really, they've been exploring the science of happiness and the science of well-being. And Corey Keyes came up with this other axis that goes between the notions of flourishing and languishing. And flourishing is kind of that state of emotion of feeling engaged with life, having a sense of purpose and direction, generally feeling quite buoyant and optimistic and positive mood. It doesn't mean that you're always happy or that bad things never happen to you and every day's a sunny day, but it does mean that your sort of default setting is those positive emotions, and it gives you more ability to bounce back and be resilient in the face of the ups and downs that life throws at us. By contrast, languishing is kind of the inverse. It has been described by some academics as a hollow and empty life. So it's kind of that sense of people that are drifting, don't really have a strong sense of purpose or where their life is going, don't feel particularly engaged in life, whether that's with work or in relationships or with their community. Essentially low mood and very easily falling into more difficult mental distress, often associated with high use of substances. If we sort of look at that as kind of then a sort of a more holistic picture of what mental health is, and we think about the current state of New Zealand, it's not sort of, people can actually be operating in different parts of that quadrant at different times. But in general, about 1 in 5 people in New Zealand during the course of a year will be going through mental distress that could be categorised as mental illness. And in fact, across the whole life course, the latest longitudinal figures are showing that about 80% of us will go through a time of significant mental distress. Some of the research that has been done into the notion of languishing and flourishing has indicated that about 1/3 of all Kiwis are mainly operating in that kind of languishing space. So, not very engaged, low mood, very vulnerable. And only about 25% of us are operating in that kind of flourishing state, that optimal state at any one time. So if that's kind of the one concept of mental health, and that's kind of the state of things, then what is it that we're aiming to do around mental health and well-being? And we are very much in this model that our aim is to try and move as many people as possible into operating in that flourishing space. So it's a shift from the notion of moving from mental illness to just the lack of mental illness to the notion that what we're aiming for is flourishing. And in fact, it's quite possible to be operating in that flourishing space and still be living with symptoms and issues relating to mental illness or mental distress. And I know that for absolute certain because I live with bipolar disorder and have done for many decades. And yet, through a variety of strategies, I believe that I live a flourishing life. I hold down a CEO role. It's my 4th CEO position. I'm a parent of a couple of teenagers. I've got a relationship. I'm engaged with my community. I've got hobbies and interests. I'm a musician. I do a bit of surfing, all kinds of things. I basically have a life where I feel very engaged and purposeful. And yes, the symptoms of my bipolar, bite me several times a year. And this year with COVID, that's been more often than not. But I recover, and on the whole, I live this kind of flourishing life. And I suppose, in many ways, the reasons why I've been able to do that are kind of caught in what we present in a lot of our resources for workplaces is the 3 PO, or the 3 pillars of wellbeing. I think these apply to individuals, but also to communities, to workplaces, to schools, to whānau. That, what we really are aiming to achieve is that a workplace like RSM is fundamentally psychologically safe. And that means addressing the drivers of poor mental health, of poor wellbeing. They might be workloads, they might be bullying and discrimination, they might be racism. In our wider social world, things like access to sufficient resources, to housing, again, discrimination, racism, all of these things, family violence, they all have a very big impact on people's well-being. And we can't really address a flourishing nation, a flourishing workplace, unless we're putting attention into reducing those things that can damage our well-being. Then the second PO is we want places to be strong. And that is about what are the things that proactively build up that sense of flourishing, build up that sense of positive well-being, positive mental health. And I'll talk some more about that, but there are a range of behaviours, a range of activities, the kind of culture that is created within a workplace that celebrates cultural diversity, sexual identity and diversity, which encourages people to feel like they're part of something and can participate and their voice can be heard. So I'll talk some more about that in a minute, because I think, it's the stuff that really excites me. And then the third PO is we want the places, our societies, our communities, workplaces to be supportive. So regardless of what else we're doing, people will go through tough times. A lot of our mental distress is related to things that happen to us, not just biological issues. And no matter what's going on for us, we want to be supported in appropriate and empowering ways. So safe, strong and supportive, that's the total response to mental health and well-being. And for me, I know in my own life, I've been lucky. I have been protected from a number of things that can be destructive to my well-being. I've worked at a lot of the, and been supported to build up a lot of the strength and the positive mental health. And I've got good support in my life for the times when I'm struggling. Just sort of thinking some more about, how do we build up that sense of resilience, that build up that sense of positive mental health and well-being? And there are lots of different ways of looking at it. One of the ways I like is it's an intersection of simple behaviours and habits, lifestyle things that we can put into practice that have a lot of science behind them. And if you try them, you'll find they boost your well-being. Then there's some psychological and emotional skills, sort of thinking habits, ways of approaching problems, that a small amount of skill can go a long way. And the third one is that we don't do this alone. So we need to be in supportive and resilient communities and environments. And that includes workplaces. And it's the intersection of those three things that really builds up our mental well-being. In terms of other ways of thinking about this, Te Whare Tapawhā is a great Indigenous approach. And it's really, it's developed by Sir Mason Jury, who is a great whanga to Aotearoa. And, it's a great framework for thinking about our health and well-being overall, and applies totally to our mental health. And it's really based on the notion of a whare being a house that has to have its four walls and its foundation strong for it to be strong. So, for us to have health, we need to have spiritual health. We need to have a sense of who we are, our culture, our connection to the past and the future. However you interpret spirituality, it is a part of humanity. We need to have physical health. So our physical being needs to be nurtured and looked after. We need taha whānau, we need social family connectedness to be healthy, and we need taha hinengaro, so mental and emotional health and well-being. And again, that all needs to sit on a whenua, on our sense of identity and on place. And those things all need to be in balance. We need to be working at all of those things to sustain full health as human beings. Another model, and one that works really well with Te Whare Tapawhā, is the 5 ways to well-being. And these are kind of 5 types of behaviours that you can incorporate it into your lifestyle that have enormous amount of evidence to show that they will boost your mood and your well-being. So connect, which is very similar to taha whānau. So we are social beings. We need to have relationships. We need to be connected to people, both in depth and in breadth. So we need deep, close relationships, but we also need to feel like we belong to a tribe, to a workplace, to a community, to a sports club, to a church, to a marae, whatever that sense of belonging is for you. Then to give, the old adage, to give is to receive, is actually scientifically true. By giving our time and our attention to other people, it actually boosts our sense of being valuable, of being worthwhile. It helps to make those connections. It actually, all of these behaviours actually change our brain chemistry, if you want to get into the mechanics of how they work. Take notice. This is one of my favourites, and I think it's because it's the one I've had to work at the most. And this is about slowing down and kind of being in the moment. In our Western, very busy lives, we rush, and we often do not just pause and just really take a moment to be aware of what's going on around us. And we can do this in a whole lot of ways. It can be just taking 3 long, slow breaths and sort of suddenly becoming aware of our own body. It can be taking notice of nature. I try to notice the seasons changing on the trees outside. It may be planted in asphalt in a car park, but there's still nature, and they still slow me down a bit to watch that every day. It could be making an appreciation diary and just noting 3 to 5 things every day, little things that gave me a moment of joy, so that we actually stop and smell those roses as we go. It could be, getting into mindfulness and, quite deliberate practices to bring us into the moment. But our brains need a rest from constantly thinking about the future and reflecting on the past. Our ability to do that is one of the great skills of being human beings, but we need to have a rest from that cycle of thinking about the future, reflecting on the past. Keep learning. Our brains are designed to be inquisitive, to learn new things, and we need to keep making that happen. It doesn't necessarily mean doing formal study. It can be having a hobby, learning music, just being interested in current events, listening to podcasts, reading books, but it's kind of use it or lose it. We need to keep that brain active. And then be active, the last one. There is an absolute link between our physical selves, our taha tinana, and our mental and emotional selves, our taha hinengaro. And there's lots of evidence that just mild exercise for an hour a week, not every day, but an hour across a week, is actually protective against things like depression and anxiety. So it's not about necessarily being an athlete. It's about doing what physical things you can do and enjoying those things. I don't know how you're reacting to that, but when I first came across the 5 ways to wellbeing, I kind of went, oh, wow, I wish I'd known that when I was 15. You know, if I could have realised that there are things I can do that affect how I think and feel, you know, I think, I'm not saying I wouldn't have got bipolar, but, you know, I'm sure I would have managed my life quite differently. And that sense that we have agency, that we can do something about this, you know, I think is really exciting, and it's really true. They seem simple, they seem intuitive, and they are, but they're actually based on meta-analysis of 400 pieces of research across a whole range of disciplines. So there's huge science behind them. Connecting with nature, you know, we're very lucky in New Zealand. We have a lot of access to the natural world, and it links very closely with Take Notice. Just looking at that picture of that waterfall is clinically proven to be changing your brain chemistry right now. So we're all getting a little well-being boost just by looking at that for a few seconds. Time spent in nature fundamentally rewires our brain. It plays very nicely with so many parts of Te Whare Tapawhā in the 5 ways to wellbeing. This year has been a very difficult year, and you know, the stresses of COVID-19 have put huge amount of pressure on all of us. You know, in some ways, the silver lining has been that I think during the lockdown, certainly in Aotearoa, we have spent more time being conscious of looking after our spirits, of looking after our well-being, and looking out for each other than perhaps we do at other times. And you know, that actually showed in some of the results that came through, you know, in looking at mental health and well-being during the lockdowns. What often happens is that during a community crisis like this, people feel better mentally and emotionally. And it's, you know, it's part of that connection about feeling part of the team of 5 million, about helping one another out, about looking out for our well-being, about spending time with our family and whānau, and consciously connecting with people, even if it was by phone or Zoom. But, you know, let's not deny that the anxiety, the pressure, the redundancies, the financial pressures, the businesses that went, you know, came under a lot of stress or failed, you know, there have been huge impacts on people's mental health and well-being. And there is more to come. Again, the experience around the world, including from the earthquakes in Christchurch, is that the stingers in the tail of community crises, that it's after the peak of the crisis that the mental and emotional impact can really come home to roost. And so we do need to be vigilant. You know, don't stop doing the things that you did to boost your spirits during the lockdowns. You know, there's no reason why we shouldn't be doing these things all day, every day, and make them part of our daily life. And in terms of a workplace, really leaning into how can you put these kinds of concepts into practice as a team. And we have resources on how to use the 5 ways to wellbeing in a workplace, you know, how to actually boost those 3 PO of safe, strong, and supportive, you know, in a workplace context. Just thinking about COVID-19 and thinking about, you know, our colleagues and our friends, I want to just kind of finish with this slide, which is, you know, we do need to check in on one another more at this time, you know, especially if people are remote working, but also as the months span out, you know, from the crises of COVID-19, and hopefully in New Zealand we're through the worst of it, you know, we are still going to see those effects lasting for a long time. And so if you're concerned about somebody, don't be afraid to ask them how they're going. And you don't have to have all the answers. You know, quite often when I, you know, say that to people, they go, but what if they say I'm not going, you know, I'm bad, I'm in a bad situation, or, you know, what do I do then? And I think the key thing is just be there. You don't have to have all the answers. You don't have to be the counsellor or the doctor. You don't have to solve the problem. In fact, sometimes trying to solve it can be the last thing that's helpful. But the most useful thing is to be empathetic and just to show the person that you're still there regardless of the fact that they're feeling bad, and that you're there for them and you still value them as a colleague or a friend or a family member regardless. Those are just a couple of very simple sort of tools just to help in terms of thinking about having those conversations. So remember your toes, timing. So if you're concerned about somebody, pick a time when it's likely to work to talk to them. If you're in an organisational setting, what policies does the organisation have that might help? Think about the environment. Are you going to be in a place that it's going to be safe and useful to talk to the person? And think about safety. It may be helpful to know what the EAP number is, or 1737, the sort of free counselling line, in case someone really needs that additional support. I see Steve's popped up now, so I'll probably outuse my time. So I'll just wrap up there and happy to open up to questions. But my final slide is just, look, we do have a lot of resources with the Mental Health Foundation. We're part of the Getting Through Together campaign, which is a wellbeing campaign to support the whole community around COVID-19. And we have our Working Well resources, which are focused on workplaces. So please do go further. Thank you.
Thank you, Shaun. Thank you very much for that presentation. As Shaun alluded to earlier in the discussion that he was having, I've actually known him for over 10 years, and I've seen Shaun wear two hats in two organisations as CEO, and he brings nothing but passion and level-headed guidance to the roles that he has, and it's certainly a person that's worth listening to. And I think we've had a great presentation today, and some of the items you've touched on have been very, very current. Very, very important. I like some of the takeaways, the 5 ways to wellbeing, or Te Whare Tapa Whā. Very interesting approach there, and I think it's something that should take a step back, take a bit of a think and have a look, deep breathe and think about it. I like, don't overthink the forward or don't overthink the past, just think about it now. But we do have a few questions that have come in for you, Shaun. I've got my hot little hand here. They've been printed off for me, and thank you very much for my helper today. And a few of the questions are, with a generational workforce or diverse workforce, is there a one size fits all?
Yes and no. I think, some of the principles that are within models like Te Whare Tapa Whā and the 5 ways to wellbeing, at that high level, they work for everybody. But there are many, the reason they work is because there are many ways to put them into practice. So, in terms of being active, there's not just one way to be active. You could, go for walks, which is what I tend to do, and grudgingly go to the gym. Or, people can dance, do kapa haka, go cycling, go for walks at the beach, swimming. There are lots of different ways that you can be active. And it's, very much about what you enjoy and what works for you. Similarly, take notice that, slowing down. I've heard Sam Whitelock, the All Blacks, sort of say, look, I don't do meditation, but I just kind of stop and take 3 deep breaths and just try to just feel my body. But there are other ways of getting into the moment. Some people do colouring in, adult colouring in books are some of the most top sellers in the world, because just that crafting element. Some people do weaving. Some people do knitting. That's sort of something that sort of brings you into the moment. So I guess what I'm saying is there are many ways to put those behaviours into practice.
Very good, thanks, Shaun. Another question raised here. You mentioned about the negative view that mental health has. What can organisations do to change this view?
Yeah, well, look, I'm of those three PO that we talk about, I personally think that starting with the positive mental health stuff, starting with things like the 5 ways to wellbeing and Tapa is a great place to start, because it's not the scary stuff, it's the exciting stuff. So, if you look at, what happens in your workplace, and say, many workplaces have volunteer days or volunteer programs, talk about that from the perspective of, hey, didn't that make us feel good? Let's notice that to give like that, really made us feel good. If you have staff socials or sports clubs or whatever you do, talk about the fact that, hey, we're connecting, when we're doing this, and we're building up a sense of feeling part of RSM, and notice that makes us feel good. That's actually good for our mental health and well-being, and keeping on working at that is good for us. So, the more you can actually lean into that stuff, I can't see you all, which is all a bit weird, but I know that whenever I've, talked about the 5 ways to wellbeing, often people are sort of writing it down. I've been at parties where people have run off and got old envelopes and have written it down on the back of the envelope. It's something that people suddenly say, I could do that. And I think it makes a nice, safe place to start talking about thoughts and feelings. And then, if that becomes just part of baked into the breed of an organisation and a normalised conversation, then it becomes easier to then also have the more tricky conversations when people, are not feeling so good. So we start to reframe mental health as an asset, as something positive, something we can build up, and we normalise talking about it, and therefore it gets a little bit easier to talk about the hard stuff.
Those are incredibly valid points and invaluable points as well. Getting over that hill, I think, is the tough bit, and getting over that barrier that some people do have in this area. And I think it's incredibly important that they do. So another question here is, much of the focus has typically been about the team. However, the pressures, challenges, or stress felt by team is often present with the leaders as well. How important do you think self-care initiatives are for leaders within organisations, not just the wider team?
Yeah, no, look, absolutely. Being a leader myself, I totally get that. And yeah, look, I think this is also something that you have to lead by example. You can't say, do as I say, don't do as I do. And it kind of, so, if none of us will survive or thrive or, flourish if we're not putting our energy into our own well-being and working on this stuff ourselves. But B, if as a leader or manager or, you are doing it and you're talking about it and modelling it, then people are going to feel much more likely, much safer to sort of participate. And I think it also goes to what you were talking about before, Steve, about the stigma that goes with mental distress. Mm-hmm. That fundamentally, if leaders can be open about their own experiences, that's what fully sends the signal that it's safe to be able to talk about it. So, yeah, I think we have to do it for our own good, but we also have to model it for everybody's good.
That kind of leads into another question that's just popped up on my screen here, Shaun, and you may be able to see it too. You mentioned about the culture and how important this is in creating an environment that's supportive. But is this a top-down approach or team-led or from the bottom? Which approach works best?
Well, look, ideally it permeates, throughout an organisation. I have known organisations where it started in the middle or started sort of towards the bottom and percolated up. Spark is one that's like that. They now, put a lot of effort and energy into mental well-being and sort of staff well-being across the organisation. Mm-hmm. That didn't start at a senior management level. That started through a kind of staff retreat, and some people who were very motivated to see that happen. And it really sort of percolated down and up from the middle. There are other situations where CEOs have been, really, really key to modelling that kind of stuff and leading it. Ultimately, you want that full support right through from a board, and a kind of really participatory way of trying to create that. One very simple thing that you can do, we're all required to have health and safety committees. Well, actually, we're also required to be aware of mental well-being under the same legislation. So, let's put mental well-being as a standing item on the health and safety agenda. That can really start to drive some interesting conversations.
I think that will actually. I'm going to be chairing a lot more meetings from next year onwards. I have a funny feeling I know what's going to be on my agenda going forward.
Right.
Thank you very much. I've got a last one here. A common approach for management is to refer to team members to an external party outside of the organisation. You touched before on EAP, and actually that's something that RSM does utilise. But what can managers do to help identify and do more to get the team into a flourishing space?
Yeah, look, I think there are lots of things. EAP is very valid and we use it. When you're getting into that support, the PO of, safe, strong and supportive, there are times when people need, quite formal support, and, access to EAP can be, is very valid. I think, again, if our advice to any organisation is, if you really want to create a workplace that engenders resilience and well-being and flourishing, and there's actually a very strong economic incentive to do that. There are study after study by firms like yourself that have shown, very big, over a 4-to-1 ROI on investing in mental well-being. Then you kind of need to sort of engage in a bit of a program of implementing those 3 POs. So, start looking at, what are our policies around bullying and discrimination, and then, doing a bit of an audit against, is that policy adequate? Do people know about it? But also, are we really putting it into practice? Simultaneously leaning into, let's start a program of using something like the 5 Ways to Wellbeing or Te Whare Tapawhā, in our organisation, and looking for ways to weave it and embed it into our work practices. And then also thinking about, what are the supports that we make available to people. So again, if I broke my leg in a car accident, and this is a real story, I've seen an interview with someone, was talking about, I had a car accident, broke both my legs. Everybody was extremely sympathetic about the broken bones. I became, chronically depressed as a result of the accident. Everybody thought I was a whinger. So we would work hard. We work hard to have a sort of back to work program for someone who may have been, injured or have a significant illness. We need to also think about, what are reasonable accommodations that can be made for staff when they're, going through a time of mental distress. And it may be from a long-term mental illness, or it may be because of a bereavement or a physical illness or a relationship breakup or financial worries. That, there can be a whole lot of life events, some from your past, COVID-19, that can create episodic times of distress, and what reasonable accommodations can a workplace make to encourage someone to stay engaged, but also to sort of bring, keep them engaged with the workforce and with their work, value them, without just sort of discarding them, but equally it has to work for the workplace as well. So there's a whole raft of stuff, and I really encourage you to look at our Working Well resources. What we've done there is we've got an overall kind of manual, I suppose, on mental health in the workplace, but we've tried to break it down into a series of topics and resources that people can, and we provide training workshops, not for individual organisations because we just don't have the capacity, but we train trainers. So we train HR people or, union reps or managers or people who are going to take that and put it into place in their workplace. But we've also designed the resources so, many people can just pick them up and run with them without having to attend those training workshops. So there's a lot of support out there. And again, I don't think this is something you can just, walk around the car and kick the tyres on. If you're really serious about this, then you need to embrace it as part of a culture change process or a culture enhancement process within any organisation. And look, I'm not saying it's easy. It's a constant struggle here at the Mental Health Foundation. We're not sort of, it's a journey. It's not a destination.
Okay. No, Shaun, you've certainly provided a lot of food for thought for myself, and hopefully also for the other attendees on this webinar. And thank you also as well for providing links to resources that are available. They will turn out to be potentially invaluable to many people who are listening today. As with the other webinars in this series, hopefully it'll be up and available for you to be able to see remotely after after the completion of today. And I would like to take this opportunity once again to thank you. Of course, be a silent clap from everybody because, of course, they're all on mute. And say thank you very much, Shaun, and thank you very much for your time and for your input on this very vital topic. I'd like to take the opportunity for the attendees just to let them know that the sixth and final webinar in this current series of RSM webinars is on the 19th. And that's going to be chaired by the RSM chair, who happens to be Charles Worth, and that's talking about business leadership. But we've had a diverse series of webinars over the past couple of months, and I really do appreciate the input of our RSM team in putting these together. And I certainly thank the people we've had presenting. And as I say, a massive thank you to you, Shaun, for making yourself available today to talk to us about mental health. So with that, I'll say farewell. And everybody go well. Hopefully the weather will not hinder you for the balance of the day and you can get about the rest of your business for the rest of the day. And so thank you very much. And
thanks, Steve. It's been a pleasure.
Thank you very much, Shaun. Thank you. Bye now.
Bye-bye.